Welcome back, everybody, to installment number 5 in our Learn to Love Your EHR webinar series. It's wonderful to have you here as we continue this journey of unlocking the full potential of your EHR. Now, last time we explored how advanced functionalities and strong data quality turn EHR systems into invaluable tools for improving clinical efficiency and patient outcomes. Today, we're digging into compliance, security, and patient engagement. 3 pillars that strengthen the trust and connection between patients, providers, and technology. Let's start by recapping the key insights from our previous session. We dug into the implementation of advanced features, and we explored the importance of data quality in optimizing EHR systems. We discussed how these elements transformed EHRs into valuable tools for enhancing clinical efficiency and improving patient outcomes by leveraging advanced functionalities and maintaining high-quality data. Organizations can drive better decision-making and operational effectiveness. And as we go forward, remember, these elements are not standalones. These interconnect to create a robust EHR system that supports effective healthcare delivery. So today we will shift our focus to compliance, security, and patient engagement, which are critical components of effective EHR management and healthcare delivery. We will explore strategies for maintaining regulatory compliance, for strengthening system security to protect sensitive patient information, and utilizing EHR features to engage patients. These elements interconnect to create a comprehensive approach to EHR optimization, and together, these ensure that your systems not only meet legal and ethical standards, but also empower patients and safeguard their trust. And by the end of this session, you'll have a good understanding of how to navigate these critical aspects to optimize your EHR system effectively. But before we go further, let's pause to meet our panelists. First, we have Thaddeus Dickson, the founder and CEO of Xpio Health. Thad brings more than 20 years of experience in behavioral healthcare, and he holds numerous certifications related to healthcare security, privacy, and technology. Thad is a recognized expert and a frequent speaker on issues related to behavioral health technology and national healthcare. And next, we have Traci Crowder, our Chief Operating Officer. Traci has an impressive 30 years of healthcare experience in various roles, including clinical, administrative, and consulting positions. Her expertise spans quality management, IT, risk management, and more. Traci is passionate about helping make a positive impact and helping clients and staff solve problems. We'll be hearing more from our panelists in a bit. Meanwhile, feel free to ask questions using the chat feature. We'll address those questions during the designated Q&A session at the end of the webinar. And don't worry about taking notes because we're going to provide a recording at the end of this session to all attendees. Okay, let's dive in. We'll start by taking a look at regulatory considerations for EHR optimization. Okay, to begin, let's review the major regulations that impact EHR use in healthcare. First, of course, is our old pal HIPAA, the Health Insurance Portability and Accountability Act. This legislation mandates the protection of patient health information, or PHI. HIPAA compliance involves ensuring that EHR systems have robust security measures to protect against unauthorized access, breaches, and other threats to patient data. Then there's MACRA, the Medicare Access and CHIP Reauthorization Act. MACRA introduced the quality payment, which includes the merit-based incentive payment system, known respectively as QPP and MIPS. These regulations emphasize value-based care, requiring healthcare providers to use EHR systems that support comprehensive documentation and reporting to demonstrate improved patient outcomes. And then MIPS itself. Under MIPS, providers are scored based on 4 categories: quality, promoting interoperability, improvement activities, and cost. EHR systems must facilitate accurate data capture and reporting across these categories to ensure compliance and optimize performance scores. Understanding these regulations is crucial as they directly influence how EHR systems are implemented and used in healthcare settings. Now let's review some of the strategies using EHR systems to streamline compliance processes. Let's start with documentation standards. Implement standardized templates and forms within your EHR to ensure consistent and accurate documentation. This includes fields for mandatory information required by regulations like patient consent or treatment plans or progress notes. Standardized documentation reduces variability, minimizes errors, and ensures that all required information is captured, which is crucial for meeting compliance mandates and improving audit readiness. Now consider reporting requirements. Use EHR reporting functionalities to generate the necessary reports for regulatory compliance. So ensure that your EHR system can compile data from MIPS reporting, such as quality measures and performance improvement activities. Automated reporting features can save time and reduce errors. Leveraging automated reporting saves valuable administrative time and enhances the security of compliance submissions, helping your organization avoid penalties and achieve better performance outcomes. And consider quality improvement measures. EHR systems can support continuous quality improvement by tracking performance metrics and patient outcomes. Implement dashboards and analytic tools to monitor key indicators and indicate areas for improvement. Regularly review these metrics to ensure ongoing compliance and optimize patient care. Using EHRs for quality improvement provides actionable insights that drive better decision-making, ensuring compliance with evolving regulations while simultaneously enhancing patient satisfaction and outcomes. And next, let's discuss strategies for leveraging EHR systems to streamline compliance. You can enhance compliance with continuous monitoring. Continuous monitoring of compliance status is crucial. Utilize EHR integrated compliance dashboards to track real-time compliance metrics and identify any potential issues before they escalate. Regularly review these metrics with your compliance team to ensure proactive management of regulatory requirements. Continuous monitoring allows organizations to catch potential compliance issues early, minimizing risk and ensuring that regulatory requirements are consistently met, which protects the organization from penalties and reputational damage. Now consider training and education programs. Invest in ongoing training and education programs for staff to stay updated with regulatory changes. This ensures that everyone's aware of their roles and responsibilities in maintaining compliance. Training should include practical examples and case studies to help staff understand the implications of non-compliance. Keeping staff informed about evolving regulations ensures that they're better equipped to comply with requirements, fostering a culture of compliance and reducing the likelihood of errors that could lead to violations. And all this lets you use EHR data for compliance audits. Leverage EHR data to conduct internal compliance audits. Automated auditing tools can identify discrepancies and areas that require attention. These regular audits not only ensure compliance, but also prepare your organization for external inspections, reducing the risk of penalties. Conducting regular audits using EHR data provides a proactive approach to identifying gaps, enhancing operational efficiency, and ensuring readiness for external reviews, which builds confidence in your compliance framework. This feels like a good time to stop and introduce you to someone special. Meet Traci Crowder, Xpio Health COO and a true healthcare technology pioneer. With 30 years of experience across clinical care, hospital administration, and consulting, she brings battle-tested expertise in quality management, IT systems, and program development to every single challenge. When she's not transforming behavioral healthcare technology, you'll find her conquering the Pacific Northwest itself, bringing the same fearless energy to the wilderness that she brings to her work with Xpio's customers. Ask her about the Northern Lights, and please welcome Traci Crowder.
Thank you, Brian. Thank you for that introduction. And hello, everyone. Thank you for being here with us today. I've said this in previous webinars, but one thing that I do want to emphasize is your EHR go live is just one milestone in your EHR journey. And that's what everyone works toward. And it is a heavy lift, the go live, getting to that point. But optimization of the system after go live is critical to ensure compliance, efficiency in your operations, and to ensure user satisfaction. The compliance strategies that Brian spoke about are sometimes overlooked during the initial build out and rollout of an EHR. But a major lesson learned for me is that achieving compliance requires some attention after go live. So there's opportunity and ongoing optimization to strengthen compliance and to make it easier for your organization. Of the strategies that Brian talked about, in my experience, you get the most bang for your buck with standardized documentation and real-time monitoring, and then reinforcing that with staff training and internal auditing. Ensuring your forms are collecting the required information, making fields required with a hard stop if not completed, and streamlining your forms where you can. So end users don't have to complete so many or remember which ones to complete. With most systems, you can also create form bundles so you ensure all necessary forms are completed when they're due. And I think also configuring real-time data validation rules within your system helps to prevent errors and maintain compliance and safe care. One of the things I like about EHR systems for real-time monitoring, most systems offer functionality like compliance widgets or windows that appear on your home screen, showing when documents are due or if they're overdue. And you can configure these to provide notification, certain number of days before the document is due. Also helps with compliance. Brian mentioned reporting. I'll say that creating reports that identify data compliance issues like missing data or inaccurate or incomplete data. And you can run those reports whenever, but you can also have the reports feed into analytics dashboards so you get a quick visual of how you're doing with compliance. Brian is now going to talk about one of my favorite things to work on, patient engagement, and using your EHR with patient engagement. So I'll turn it back over to you, Brian. Thank you.
Thank you, Traci. And yes, it is time for us to learn about patient engagement. How can we use our EHR to enhance patient engagement? EHR systems play a pivotal role in enhancing patient engagement by providing tools and features that empower patients to take an active role in their own healthcare. Key components include patient portals. These secure online platforms allow patients to access their health records, view test results, schedule appointments, and communicate with their healthcare providers. And by giving patients direct access to their health information, portals encourage active participation in their care. Patient portals foster transparency, improve communication, and empower patients to take control of their care, which increases engagement and strengthens the patient-provider relationship. EHR integrated telehealth capabilities enable virtual consultations, making healthcare more accessible and more convenient. Telehealth bridges the gap for patients with mobility issues or for those living in remote areas, ensuring they can still receive quality care. Telehealth reduces barriers to care by providing patients with flexible and timely access to their providers, which improves engagement and ensures continuity of care, especially for underserved populations. And personal health records. These are controlled by patients and include information from various healthcare providers. They empower patients to manage their health data, track their progress, and share information with multiple providers, promoting coordinated care. PHRs encourage collaboration among healthcare teams and give patients ownership of their healthcare information, making them active participants in their care journey and supporting more personalized treatment plans. EHRs with patient portals, telehealth features, and PHRs create a more collaborative healthcare environment, enhancing transparency and enabling patients to make informed decisions about their own care. And this ultimately improves outcomes and satisfaction. Now, to maximize patient engagement, it's crucial to design and implement EHR features with the user in mind. Here are some best practices. Ensure that patient portals and EHR interfaces are accessible to all patients, including those with disabilities. This includes compatibility with screen readers, adjustable text sizes, and intuitive navigation. Designing for accessibility ensures inclusivity, allowing all patients to engage with their health information regardless of ability, and aligns with legal requirements such as ADA. Design interfaces that are easy to navigate and understand. Use clear, non-technical language and avoid overwhelming users with too much information on a single screen. Simplify the layout and ensure that the most frequently used features are the most easily accessible features. User-friendly interfaces reduce frustration and increase adoption rates, enabling patients to actively engage with their health information and participate in their care journey, which improves outcomes and strengthens the patient-provider relationship. Present patient data in a way that is easily understandable and actionable. Use visual aids like charts and graphs where possible to help patients grasp their health information quickly. Include explanations for medical terms and provide context for lab results to help patients understand their health status and next steps. Providing actionable and clear data empowers patients to make informed decisions about their health, fosters trust, and encourages active participation in health plans, which can lead to better health outcomes and stronger compliance. Privacy and security. Ensure robust security measures are in place to protect patient data. Patients are more likely to use and trust systems that guarantee the confidentiality and security of their personal health information. Strong security and privacy measures build patient confidence, encouraging them to actively engage with EHR systems that share accurate, sensitive health information, which is critical for effective care and compliance. One effective way to enhance patient engagement is by integrating patient feedback into the design and functionality of EHR features. Conduct surveys and focus groups and gather insights on what patients find most useful or challenging about current systems. Use this feedback to make iterative improvements, ensuring that the EHR remains aligned with patient needs and preferences. Incorporating patient feedback ensures the system is user-centric, addressing real-world challenges and enhancing satisfaction, which drives higher adoption rates and sustained engagement. Effectively promoting the available EHR features to patients can also drive engagement. Use multiple channels such as emails, in-clinic posters, and social media to educate patients on how to use the patient portal, how to use telehealth services, and how to use personal health records. Highlight the benefits, such as easier appointment scheduling and access to medical records. Raising awareness about EHR features helps patients recognize their value and understand how to use them, reducing barriers to adoption and encouraging more consistent engagement with the system. Implementing these best practices can significantly enhance patient experience and engagement with EHR systems. Okay, in this next section, we're going to explore best practices for safeguarding electronic health records through robust security measures. The importance of maintaining patient privacy and strategies to improve your system remain compliant with evolving regulations. So we'll also touch on how prioritizing security and privacy in your EHR system can improve patient engagement and reduce risks and strengthen your organization's reputation. In the digital healthcare landscape, protecting patient data is of utmost importance. Data breaches can have severe consequences, including compromising patient privacy, damaging trust, and incurring significant financial and legal penalties. Given the sensitive nature of health information, maintaining robust data security and privacy protocols is not just a regulatory requirement, but rather a fundamental component of patient care and organizational integrity. Patients must be able to trust that their personal health information is secure. This trust is essential for open communication between patients and providers, which is critical for effective treatment. Compliance with regulations like HIPAA is mandatory. These regulations set stringent standards for protecting health information, and noncompliance can result in hefty fines and legal action. A data breach can disrupt healthcare operations, causing system downtime and diverting resources to address the breach's aftermath. Protecting data ensures continuous, reliable healthcare delivery. Implementing a comprehensive security framework for EHR systems involves multiple layers of protection to ensure patient data is secure and accessible only to authorized personnel. This framework addresses security measures to create a robust defense against threats. Key measures include encryption. I can't say this enough. Encrypting data both at rest and in transit ensures that even if data is intercepted or accessed without authorization, it remains unreadable. Use strong encryption algorithms, and encryption keys should be managed securely. Encryption acts as a critical safeguard against data breaches, ensuring that sensitive health information remains protected, which builds trust among patients and helps us meet regulatory compliance requirements. Access controls. Implementing robust access controls helps ensure that only authorized personnel can access sensitive health information. This includes role-based access control, or RBAC, which grants access based on a user's role within the organization, and multi-factor authentication, or MFA, to add an extra layer of security. Access controls reduce the risk of unauthorized access, ensuring sensitive data is only accessible to those who need it, thereby minimizing insider threats and strengthening the overall security posture. Regular security audits. Conducting regular security audits helps identify vulnerabilities and ensure compliance with security policies. Audits should include reviewing access logs, penetration testing, and assessing the effectiveness of existing security measures. Security audits provide a proactive approach to identifying and mitigating risks, ensuring that systems remain compliant with regulations and capable of defending against evolving threats. Additional key measures include physical security. Ensure that servers and other hardware containing patient data are physically secured. This includes using locked rooms and surveillance and secure disposal methods for retired equipment. Physical security prevents unauthorized access to critical infrastructure, protecting patient data from theft or tampering, and ensuring compliance with privacy regulations. Then data backup and recovery. Regularly backing up data ensures that patient information can be restored in case of a data loss due to breaches or system failures. Backup processes should be automated, and backups should be stored securely. A reliable data backup and recovery plan ensures continuity of care and safeguards critical patient information, minimizing downtime and the impact of data breaches or disasters. To effectively manage cybersecurity risks, healthcare organizations must adopt a proactive approach. This involves identifying potential threats, developing a response plan, and fostering a culture of security awareness among all users. Regularly conduct risk assessments to identify potential cybersecurity threats in your EHR systems. Leverage tools like vulnerability scanners to conduct simulated attacks and test your system's defenses. And additionally, stay updated on emerging risks by using threat intelligence feeds and collaborating with cybersecurity organizations. Proactively identifying and addressing potential threats ensures your organization stays one step ahead of cyber criminals, reduces vulnerabilities, and safeguards patient trust while meeting regulatory compliance requirements. Establish a comprehensive incident response plan to effectively detect, respond to, and recover from cybersecurity incidents. This plan should include detailed procedures for identifying incidents, containing threats, mitigating damages, and restoring systems. Define roles and responsibilities clearly for all team members, set up communication protocols, and ensure regular testing of the plan through mock drills to refine its effectiveness. A well-defined and well-tested response plan minimizes disruption and financial loss during a security incident, enabling faster recovery and helping maintain patient trust while ensuring compliance with incident reporting obligations. Educate all users, including administrators, clinicians, and staff, on the importance of data security and best practices for protecting sensitive patient information. Conduct regular training sessions that cover recognizing phishing attempts, using strong and unique passwords, safely handling patient data, and staying alert to common security risks. Reinforce these practices with ongoing reminders, posters, and interactive simulations. Creating a culture of security awareness reduces human error, which is the leading cause of data breaches. It also empowers staff to serve as this first line of defense against cyber threats, significantly enhancing the overall security posture of your organization. Conduct regular training sessions on security protocols to maintain high standards of data security. Incorporate real-world scenarios and simulations and interactive activities to make training more engaging and more impactful. Ensure continuous education to address evolving threats and reinforce the importance of cybersecurity. Empowering staff with knowledge and skills reduces the risk of human errors, which are the leading cause. Again, human beings are the leading cause of data breaches. Regular training fosters a security-conscious workforce and ensures your organization stays ahead of emerging threats. Deploy advanced threat detection systems powered by artificial intelligence and machine learning to monitor and identify unusual activities and potential cybersecurity threats in real time. These systems can analyze patterns, detect anomalies, issue early warnings, all of this enabling your team to respond swiftly and effectively. Integrate these tools into your existing EHR infrastructure to enhance overall system security. Advanced detection systems provide an extra layer of protection by identifying and mitigating risks before they escalate, reducing the likelihood of breaches and minimizing damage to your organization and patient trust. And again, create a robust disaster recovery plan to ensure your organization can recover data and restore operations quickly. The plan should include clear procedures, defined roles and responsibilities, and tools for efficient data backup and restoration. Regularly test the plan through drills to verify its effectiveness and ensure that all staff members are familiar with their roles. A well-prepared disaster recovery plan ensures business continuity, minimizes downtime, and protects critical patient data during emergencies, safeguarding the organization's reputation and compliance with regulatory requirements. By implementing these security measures and fostering a culture of awareness, healthcare organizations can significantly reduce the risk of data breaches and ensure the privacy and security of patient information. Let's pause here so I can make an important introduction. Please meet Thaddeus Dickson, founder and CEO of Xpio Health, a tech visionary with a counselor's heart. His unique journey from case management to healthcare technology spans 25 years, blending deep behavioral health expertise with technical innovation. As a security expert, certified by ISC2, Microsoft, AWS, and Google, Thad leads Xpio's mission to transform behavioral healthcare through smarter technology. When he's not serving as a trusted CISO for healthcare organizations, he is sharing his insights as a recognized expert at the intersection of technology, healthcare, and security. Please welcome Thad Dickson.
Thank you, Brian and Traci, and I appreciate the introduction, Brian. I think one thing that's increasingly important is to not only scrutinize the security and compliance of your EHR within the actual user administration features and the access privilege in the EHR itself, but to consider your EHR as part of a larger ecosystem of moving parts, if you will, within your IT infrastructure. And a lot of us tend to delegate the cybersecurity of our EHR to our vendors. And I think that that does work to an extent, but I would remind everyone that ultimately the security of your electronic health record system still does fall on your shoulders as a covered entity. And so I think that increasingly, with all of the moving parts across the technology landscape, it's important to fold that EHR into a global view of your compliance. And I can give you an example of some of the challenges that organizations face with even just the user management piece. As you onboard and offboard users within your Microsoft Office, for example, administrative console, those offboarding events in the case of terminating staff or changing or adding staff really need to have a routine that helps you track that and abide by your SLAs or your basically service level agreements, which is to say the timing. And so if your objective after somebody is offboarded, it's to remove their licenses from all relevant systems, you need to know what systems that person is provisioned into. And so back to the global view of your overall IT landscape, including your EHR, it's important to source those users that are in your EHR into some type of centralized repository that looks at the Microsoft accounts or the Google accounts, whatever the case may be, and looks at the users and the roles and ensures that there's fidelity between those. We really are a fan of automation more and more as we look at how these different user accounts are, spread across our organization. And that requires a couple of things. One thing it requires is an inventory. You need to know all of the systems that contain PHI and what users are provisioned into those systems. Most organizations use a variety of systems, and it can be very hard to keep a consolidated view across that. And so finding solutions that automate that process and have those different users all across a dashboard that you can look at. And as soon as you then offboard somebody from Microsoft, you should get a trigger which says, hey, this user also has accounts in Slack and in your EHR and in your HR system. And in that capacity, you can then be very methodical in ensuring that you abide by judicious removal of those users. And really, we're finding that this is very hard to do manually. And so as organizations increase their technology acumen, we recommend looking at consolidated platforms like Vanta or others that take all of that data and dashboard it for you. And they also dashboard it against what we call frameworks. And frameworks are things like HIPAA, SOC 2, NIST, and HITRUST. And those are security controls that have different rules, policies, and procedures and engineering tests that correlate to those. And so I would really encourage organizations to engage with different methodologies, even if it's sourcing reports manually and checking when you're just starting out. Get that user list out of your EHR, compare it to your actual HR system and your Microsoft admin user system, and ensure that there's continuity and consistency between those. So with that, I certainly know that this is increasingly challenging, but also know that the tools and technologies are out there to help automate these tasks.
Okay, let's take a moment to review key takeaways from this discussion today. These points will summarize the critical insights and actionable steps you can implement to strengthen security, enhance compliance, and improve patient engagement using EHR systems. And while we review, this is also a great time to think about any questions you might have, as we're going to be moving into the Q&A session shortly. Let's dig into these key takeaways. Okay. Regulatory compliance. We discussed the importance of understanding and complying with key healthcare regulations like HIPAA, MACRA, and MIPS. Leveraging EHR systems to streamline documentation, reporting, and quality improvement processes is essential for meeting these requirements. Non-compliance can lead to hefty penalties, reputational damage, and disruptions in your patient care. By streamlining compliance processes, your organization can reduce administrative burden, maintain trust, and focus more on delivering high-quality patient care. Okay, patient engagement. Enhancing patient engagement through EHR technologies such as patient portals, telehealth features, and personal health records can significantly improve health outcomes and patient satisfaction. Implementing user-friendly and accessible features is critical. Engaged patients are also more likely to adhere to treatment plans, stay proactive in their health, and feel satisfied with their care. Investing in these features not only strengthens patient-provider relationships, but also contributes to better long-term outcomes. And data security and privacy. Protecting patient data is paramount. Implementing robust security measures, managing cybersecurity risks, and fostering a culture of cybersecurity awareness among all users, these are crucial steps for ensuring data privacy and integrity. A data breach can compromise patient trust, lead to regulatory penalties, and disrupt operations. Prioritizing security safeguards the organization's reputation and ensures compliance while protecting sensitive health information. Now I want to share a preview of what's in store for the final webinar in this series. In our next session, we will dive into leveraging EHR data for quality improvement. We'll explore how advanced data analytics can help identify trends, support clinical decision-making, and ultimately drive better patient outcomes. This includes utilizing predictive and prescriptive analytics to implement targeted interventions and improve both clinical and operational efficiency. We'll also look at navigating future developments in EHR systems, such as anticipating regulatory and technological changes and integrating new innovations like AI and blockchain. The goal is to ensure that your EHR systems remain adaptable and scalable for future demands. And finally, we'll focus on continuous EHR optimization. This includes the importance of regularly reassessing your system, gathering user feedback, and making iterative improvements to keep pace with the evolving needs and maintain peak performance over time. As we conclude, I want to encourage you to build a culture of continuous learning within your organization. Stay informed about advancements in EHR technologies. Stay informed about regulatory updates and best practices. Regularly evaluate your EHR system by gathering user feedback and identifying areas for improvement. Focus on improved functionality, user experience, and staff training to ensure your team is equipped to adapt to changes effectively. And by embracing this mindset, your organization can deliver better patient care and streamline operations. Thank you for joining us today. We look forward to seeing you at our final session, where we will explore how to truly learn to love your EHR by unlocking its potential for driving quality improvement, staying ahead of healthcare trends, and keeping your workflows optimized. And together, we'll make sure your EHR becomes a partner you can rely on, not just a tool you tolerate. Have a wonderful day, and we'll see you next time. Now let's check out some of the questions that have come in during this session. Hang on a moment. Let's see. Okay, here's one, and we get asked this a lot. What are some examples of real-time data validation rules?
I'll take that one, Brian.
Thank you, Traci.
One thing that you can do is to check your EHR's configuration settings for data validation rules and enable as many as those as you can. Some of the easy ones are like turning on required fields, so you prevent people from moving forward if they don't fill in those fields. enabling drop-down lists so that you can standardize the responses and reduce typos and data entry mistakes. You can also use auto population feature, so pulling in existing client information to prevent duplicate entries or data entries that don't match. There's also things that you can do with prescribing. If you're using e-prescribing, you can turn on medication allergy alerts. So you prevent prescribing if the person has an allergy to that medication. So I would say start small. Some of these things that are embedded in your EHR system already, and then scale later as you get those easier things enabled.
That's great, Traci. Thank you for that. This next one's kind of the $64,000 question. This is a big, big question. How do we know if optimizing our EHR is a better option than getting a new one?
That's a great question, and kind of both a hard one to answer, but kind of a foundational premise upon which I think organizations need to evaluate their return on investment. I will say that with a few exceptions, in general, making the most of the EHR that you do have is the low-hanging fruit. And even if you were to decide today that you want to go forward with a different vendor, a different EHR, you're likely going to be living with the one you have for a good year or more out from the day you even make that decision. And so I would say most of the time, getting your current EHR optimized is going to be the right choice, especially if you are not yet started on a procurement journey, or an evaluation of the other vendors that might be out there. I do think at the same time, you really need to evaluate your vendor relationship and support and ask yourself if this is a vendor who has lived up to your expectations of how they treat you and how their EHR works for you, and if it's something that you want to go forward with. Sometimes those vendors do have substantial updates that are coming as well. And so if your technology feels like it's lagging behind, engaging with your vendor to see what kinds of new releases and roadmap they have that might be able to actually offer you some new feature sets. I think another important consideration is how up to date is the tech stack with the feature and versions that you're on. And so one of the things we're seeing in the marketplace here is, some new vendors coming in. And although new vendors always come with risks, oftentimes those new vendors have some technology advantages. And one of the advantages is that they're building on a newer tech stack. And when you look at sort of the, I'll say, typical and larger vendors that are most prevalent in the marketplace, behind the scenes, a lot of those vendors are still leaning on what I'll say are somewhat legacy databases and legacy architecture. They may have updated their user interface, their color schemes, some of the features, but in the background, it's a huge lift for a vendor that has been in the market for some time to go through an entire new technology refresh. And so I think comparing your satisfaction level with the current vendor and what the market's new vendors are offering is an important step in deciding to what extent you want to go forward with full optimization, or maybe take, as I mentioned before, some of those low-hanging fruit options, and just take some of the billing configurations to make sure you maximize your revenue, your ease of use. Pick 3 to 5 high-value areas that you can efficiently optimize. And then if you need to pivot to some type of technology refresh, you at least have your staff, functional, if you will, in your existing system. And then the third thing to really look at is how much complexity and system customization have you invested in your existing EHR. There is sort of a pitfall of moving over to the latest and greatest, hence our seminar and series here on optimizing your EHR. And that is that getting a whole new EHR is a big lift. And yes, you benefit from the new technology, and some of those technologies greatly increase the usability and the configurability, from an end user standpoint, to get the, features that you need implemented cost effectively. At the same time, you're going to have, if you have a lot of customizations and complexity, a big lift to make that new EHR look like the old EHR. And I would say that if you don't carefully manage your implementation, it certainly is not unusual for organizations to adopt a new EHR and find that it's missing vital features that they used to have. And so really vetting that new EHR, understanding how it compares to the features you have today and that you've gotten used to, and understanding and making sure that you can actually replicate those features in the new EHR. So those are 3 things to consider if you're evaluating your current tech against new options in the market. Thanks, Brian.
Thank you for that, Thad. I appreciate it. And Traci, I want to ask you to chime in on this same question. You've helped so many organizations stare down this very question. How do they know if optimizing is a better option than getting a new EHR?
Yeah, we do get this question a lot. And I think that people, they get their EHR up and running, and particularly if it's not optimized, your end users, your clinicians, your billers, they might be very unhappy with it, and it would be a very common thing to say, this one stinks, we want to get another one. But the optimization is a less expensive route to take for sure. And there are so many ways that you can optimize your system. For organizations that have smaller IT staff or smaller group of staff that are managing the EHR, it feels daunting to take on some of this optimization. But I think if you can create a method for feedback from end users to hear about what their pain points are, and then choose the top 3 to 5 that are impacting the most people or impacting your billing, and just work on those, because some of those things you can focus on high impact, low maintenance solutions that require minimal customization. And so instead of overhauling everything, start with the most error prone and high risk data fields. And sometimes those are just like patient demographics that you can make required, or some of your billing and coding configuration that you can improve, that will decrease your claims denials. So yeah, I would say start with things that are high impact and low maintenance, and that's going to go a long way with improving your operations and improving your end user satisfaction.
Excellent. Thank you so much for that, Traci. Okay, here's another one. I love this question. Security is a huge concern, but so is usability for clinicians and patients. How best to balance cybersecurity and usability?
I think that's, again, another one of those really good questions, and managing, I'll say, the tension between, good/high security and usability is kind of an ongoing balancing act within any tech stack. And for example, you can give your users all permissions to all areas of the EHR, and then when they're looking for a chart, they never have to go through IT to try to get permissions to see it. And I think what oftentimes a root of some of the confusion and the concern is around here is not having a good global view of what your minimum required security requirements are. And as we deal with SUD versus HIPAA, and as the regulations change, a lot of times we're not sure what types of releases of information we have or are needed. And so I go back to, a process for managing your security within a well-documented set of policies and procedures and engineering tests. And if you have a good grasp of what are the 75 controls in HIPAA, what are the controls in SOC 2 that you need to abide by, that really helps build a foundation for what I would say is not hiding behind HIPAA if your goal is to keep the system very restrictive, but to really know what the law and the regulation is and ensure that you're navigating those regulations within the actual spirit of the intent. HIPAA is not particularly prescriptive, and that means really that there's a lot of flexibility in how you achieve HIPAA compliance. At the same time, one needs to guard against negligence, and that's really, from an insurance company standpoint, the bar that you're held to if there is a breach and you're going to be held accountable for that breach. So this comes down to staff training and ensuring that you've documented that training and that you know all of your staff have an annual HIPAA training. It also comes down to ensuring you do routine phishing tests and document that you've tested staff with basically, phishing emails, and see who clicks on those emails, and then go back and loop back with an educational feedback and advise those staff members that if there is an attachment from an unknown source, that they're not advised to click on that attachment. And so I think those are all things that help balance, which something that I really appreciate is ongoing tension between access and security in any tech system. Thanks, Brian.
Thank you, Thad. Okay, that wraps up our session today. Thank you all so much for being here. And we look forward to you joining us next time for the 6th and final edition of this webinar series, Learn to Love Your EHR. Bye, everybody.